you very much for everyone for joining us today. So Wednesday, the 25th of March is obviously FND Awareness Day in the UK, and I'm really happy to have Nada from Australia and FND Revolution with me. She did an amazing job interviewing me about 10 months ago when I first started launching Neurolog. So she's going to give me a hand today hosting our session, and I'll hand over to you, Nada, to say thank you very much.
Awesome. Oh my God, I can't believe time flies, Steve. When I think of all that you've achieved in such a short period, I've just come along with the journey and grateful to be part of it, majorly because I think the whole focus of FND Revolution is about driving change and really understanding what the latest insights and learnings are for us in the FND community, and so we can help find answers, find help. And so hence I am very excited to be back here, Stephen. So Steve, tell us a little bit, like, it's been 10 months now. Holy cow, time flies. Tell us a little bit what's going on. I mean, Neurolog Technologies,
yeah, that's
thermostat.
Yeah, thank you. Yeah, so I'm really happy to announce that we've nearly reached our 2000th user of Neurolog from 13 different countries, and it's over 4 continents now. So we've collected nearly 25,000 symptom logs, and the help that you specifically gave me around the co-occurring conditions questionnaire that we did, that I believe is one of the biggest in the world now. So we've reached nearly 800 responses for that specifically, and it's really uncovering things that we'd never really learned about, or what people knew about the disorder from that perspective as well.
That's huge, because if we take a moment, the actual beginning was really about capturing an FND patient's kind of symptoms, helping prepare for medical appointments, keeping a bit of a record, a bit of a journal. But then the survey took it to that next level where it provided a bit more ability for people to really provide open-ended feedback and experience. And how has that come to become valuable?
Yeah, I mean, so we've published a number of different papers from the information that we're collecting from the Neurolog users. I mean, as you'll see from social media, we try to give back as much as possible to the community. So we've created a number of self-help guides around things like breathing exercises, ACT, CBT, so lots of different therapies, because one of the big things I was very mindful of is I didn't want this to become a bottomless pit where people were just logging every day and never seeing help. So from a community perspective, we're constantly trying to feed back that information and give tricks and tips to help people live more of a manageable life. And then on the more sciencey side, we've had a number of different papers published about lots of different areas, which you've been kind enough to share on your socials as well. So it's balancing the two. It's giving back to the community and the users, and then also obviously forwarding science and research from that perspective as well.
That's been huge. Oh, look, I know personally the insights have really helped me further, you know, I'm not alone. That's one of the big things, particularly with a lot of people coming on board new to the community, that this isolation and thinking that you're the only one with these issues, these feelings, these emotions, these symptoms, it's hugely helped. What is the feedback? I mean, can you give us some highlights of some of the feedback that you've gotten from the community, but then also what has the feedback been from the medical professionals as well?
Yeah, I mean, I'm really blessed and touched. So all of the lovely comments that I get on Facebook and Instagram of people saying thank you so much and how inspirational I am. I'm not really that type of character, but it's lovely to obviously hear that on a day-to-day basis. From a science perspective, we're obviously still working very closely with the University of Oxford. So they're one of the leading universities in the world, and they've been amazed by the information that we're collecting. And it's something that we can't do as an online community together. So it's before we were assessed when we went to an individual doctor's appointment or if someone was hospitalized, but this is something which is providing live information which they can research month on month. So something which would have taken years previously can be done very quickly in terms of enhancing and driving that research forward as well.
Huge, and that's when you really start to see that point of difference. Like we talk about change, not hearing the same 5 facts be thrown at us from the medical community, you know, really starting to unpack what life with FND really is like.
Mm-hmm.
And so what are some of, like you mentioned, some of the themes when you talk about kind of the learnings and the medical professionals? Can you tell us a little bit about the papers that you recently have done or the training collateral that's been generated?
Yeah, so my paper on the emotional phenotypes of functional neurological disorder, that it's actually become in the top 10% of read papers on ResearchGate on any medical condition. So we're not talking about
oh my God.
Yeah, so it's been read nearly 2,000 times. So it put me in the top 10% of read people on any medical condition in 2025. And yeah, that really shows how much interest there is in the medical community and from different people about this type of research. It's not a medical condition which is constantly researched, and it's obviously very tricky to research. So that was a huge, amazing achievement and something that I was really proud of from that perspective as well.
Oh my, that is huge. I mean, look, you've had already, it's not even been a year. What is the kind of what is the plan for the next year ahead? I mean, I've seen a lot of insights and, you know, things that are potentially a year ahead for people with FND, but what are your plans? Like what do you see really being a game changer for this year?
I mean, so the biggest one is that we're currently working on is the differentiation between functional seizures and functional movement disorders. So we published a paper following on from the emotional phenotypes one on the emotional architecture of functional movement disorder. And we were working with a member of the World Health Organization and a member of the NHS on that paper specifically. And it started to uncover that functional movement disorder looks very similar to the body's natural freeze response. So that's obviously a natural occurrence which is meant to happen as a one-off, as a situation. And what we see in people with FMD is they're either stuck or on the precipice of the freeze response. So we can then start working therapeutically with people and say that, look, there's huge amounts of research that's been done in the past from a psychological perspective about the freeze response and the management and how you can sort of help yourself if you have problems with that. So we're hoping to explore that even further and understand that how addressing that response can then potentially help people with their tremors and their movement and with that sort of thing as well. So, and that's something that we would have never known without collecting the information that we had. So we can see what it looks like emotionally, how those emotions then affect the physical symptoms, how the physical symptoms then drive the emotions, and it's creating a very clear picture of this is what it looks like in terms of that side of things as well.
That's that unpacking of these, you know, largely known symptoms for such a long time, but getting a completely different perspective of understanding is huge,
Yeah.
is absolutely huge. So honestly, Steve, the work that you have done has been instrumental to helping us in the community, as well as those in the medical professional community around FND. And I do feel the momentum around the interest is shifting. I mean, I'm 3.5 years in now to my FND journey, and even in that period, I feel like there's a lot more momentum. What do you feel have been the kind of contributing factors to this new change coming through of interest?
I mean, a lot of people have probably seen like the Theoda thermostat, and it's not just a marketing gimmick. So for a long period of time, we were told that the software's broken in our heads, given a website, and then pretty much left to get on with dealing with a very tricky medical condition, which caused a lot of people feeling that they've been completely disregarded and left alone by the medical system. But I think the thermostat, it provides a little bit of hope. So we can understand that there could be a number of different psychological or biological factors which have caused us to become slightly miscalibrated and more sensitive. It's not that we're dramatic or neurotic or anything of the terms that I've used before. We're simply sensitized, so as human beings, and understanding that our thermostat's a little bit off because what we've been through and how we can potentially make sure that we stay regulated, and the different things that trigger us and that push us into different symptoms. That management of that thermostat in comparison to being told that the computer in your head's broken, which you can't see and you've got no way of dealing with, is hopefully a way to understand how we can keep ourselves emotionally and physically regulated to help manage the symptoms a little bit better from that side as well. So
that's a great icon for us as well. Like it's a super fun one, but to have that underlying message and importance in every way that you share your content, I think is really important, that there is that representation. It isn't just another report that's a challenging one to read with a whole bunch of jargon. It can be easily consumed for us as well, because us being the patients are the ones that are helping generate the reports in working with Neurolog and yourself. So how can the FND community help as part of the work that you're doing?
yeah, I mean, it's just a case of as I said when we first spoke, it's completely people's choice whether or not they use the app. If you've just started on your FND journey, then it's definitely very useful to log for a few weeks to get an understanding of what your triggers are and different things, because every day felt like a nightmare lottery when I was first diagnosed. The unpredictability of the condition is definitely one of the biggest challenges. I think you'll understand firsthand. You wake up and you never know what's going to happen. You never know whether or not your body's going to be working properly. And that confusion and distress and anxiety is something that's going to constantly keep driving those symptoms. So being able to take back control and understanding your triggers and everything is definitely gonna help people at that first part of that journey to help from that side of things as well.
Yeah, absolutely. I couldn't agree more. Having that understanding without a tool like that, it takes time. It takes time anyway, you know, and I think any way in which we can shortcut and help people with that process of really starting to understand their FND and their journey with FND is incredibly, really impactful and helpful. Look, this has been amazing. Again, I still can't believe it's only been 10 months. I feel like the amount that you've been able to accomplish with helping advocate for FND and drive change is huge.
Thank you.
And that's the big game changer. It is, how can we collectively help make that change with us? Because without working together, I am a huge believer we are not going to get any traction. And that's why I'm such a big fan of Neurolog Technologies, because it is about this collective approach for answers. So any final words for everyone?
Yeah, I mean, I just want to say thank you so much. There's a few, feels a little bit like an Oscars speech, but there's a few people that I want to say thank you to. So obviously a massive thank you to you. You've been amazing with everything that you've done on your socials and your Instagram. There's Stuart Shaw, who's a member of Lloyd's. He's been massive on LinkedIn and been a huge supporter from that perspective. Jason Kreutzmann, who is the FND OT, who is based in America. You'll see lots of his videos. He's actually, because my movement and I'm not able to leave the house very much isn't great, he's actually going to be presenting Neurolog at the FND Society conference in Baltimore in America, which gives us the opportunity to be able to showcase that. That's from
huge.
The perspective. Huge. Yeah, I mean, we've had 3 abstracts accepted, so we're going to get a chance to showcase that to literally the leading medical professionals in the world. Just want to say thank you to Paula, who's the director of Reattach Academy. So we do some training programs for clinicians and therapists, which she's had accredited, which is another part of the evolution of Neurolog. And finally to Tanya Bell, she's always been great, and Audrey from FND What Now. So she's been the charity who's actually supported me from the start. She's been so open-minded and amazing about the way that she's embraced Neurolog and really helped to push out to the community in South Africa. And I can't thank her enough as well for being charitable from that perspective as well. So
it's just the start, sadly, but it's just the start. And I'm really grateful for the opportunity that we've been able to meet and work together on this, because I genuinely feel like it's a game changer. And I really think collectively, Steve, the power of that data and insight and stories from the collective community are really, and it's your hard work of getting it all together. And, you know, I thank you for your tireless effort in putting this together.
Thank you.
And starting this initiative, because I know me, it all gets too hard. And whilst I've been good at the creative side of things, other things get too challenging. If it's not work, everything else gets a little bit chaotic and gets too hard. But you've been able to channel your energy, your efforts, your advocacy, and yourself so much into this work that it's going at scale now within less than a year to that global level of change, and education is huge, absolutely huge. So
I mean, I just want to add that, I mean, that I'm not here for the sympathy vote, but it's not a big, massive technological tech company. It is literally just me. So everything that everyone sees online and all of the work that gets done on the social media and on LinkedIn and creating the app, it's literally just me. I'm not some huge, big tech company. And without the support of obviously the online community and everyone on Facebook and Instagram, I could have never have collected the information that I had done. So it's a huge achievement between everyone and efforts. So, I could have never have got to where we've got today without that help as well. So
on to the next year, my friends, on to the next